Okay, so my disease is Angelman Syndrome. Okay. So some background, it's caused at birth. Before Angelman Syndrome, it was known as the happy puppet syndrome, and this was due to the symptoms that were occurring, such as jerky movements and the hyperactive behavior. It was later on called Angelman Syndrome due to the first doctor named Harry Angelman, and he investigated the first symptoms of this disease, and these symptoms are usually seen in 2 years old. So here's a quick video. It's going to show just a background of what it is and the causes and the symptoms.
Today's topic is Angelman Syndrome. Angelman Syndrome is a genetic disorder. It causes developmental disabilities, neurological problems, and sometimes seizures. People with Angelman Syndrome often smile and laugh frequently and have happy, excitable personalities. Developmental delays between about 6 and 12 months of age are usually the first signs of Angelman Syndrome. Seizures often begin between the ages of 2 and 3 years old. Causes. Angelman Syndrome is a genetic disorder. It's usually caused by problems with a gene located on chromosome 15, called the ubiquitin protein ligase E3A, or UBE3A gene, a missing or defective gene. You receive your pairs of genes from your parents, one copy from your mother, the maternal copy, and the other from your father, the paternal copy. Your cells typically use information from both copies, but in a small number of genes, only one copy is active. Normally, only the maternal copy of the UBE3A gene is active in the brain. Most cases of Angelman syndrome occur when part of the maternal copy is missing or damaged. In a few cases, Angelman syndrome is caused when 2 paternal copies of the gene are inherited instead of one from each parent. Signs and symptoms. Infants with Angelman syndrome appear normal at birth, but often have feeding problems in the first months of life and exhibit noticeable developmental delays by 6 to 12 months. Seizures often begin between 2 and 3 years of age. Speech impairment is pronounced with little to no use of words. Individuals with this syndrome often display the following that can have severe functional deficits: hyperactivity, small head size, sleep disorders, movement and balance disorders. Children with Angelman syndrome typically have a happy, excitable demeanor with frequent smiling, laughter, and hand flapping movements. In addition to hyperactivity, a short attention span and a fascination with water are common. With age, people with Angelman syndrome become less excitable, and the sleeping problems tend to improve. However, affected individuals continue to have intellectual disability, severe speech impairment, and seizures throughout their lives. Adults with Angelman syndrome have distinctive facial features that may be described as coarse. Other common features include unusually fair skin with light-colored hair and an abnormal side-to-side curvature of the spine, also known as scoliosis. The life expectancy of people with this condition appears to be nearly normal. Diagnosis. A definitive diagnosis can almost always be made through a blood test. This genetic testing can identify abnormalities in your child's chromosomes that indicate Angelman syndrome. A combination of genetic tests can reveal the chromosome defects related to Angelman syndrome. These tests may reveal parental DNA pattern. This test, known as a DNA methylation test, screens for 3 of the 4 known genetic abnormalities that cause Angelman syndrome. Missing chromosomes. A chromosomal microarray, or CMA, can show if portions of chromosomes are missing. Gene mutation. Rarely, Angelman syndrome may occur when a person's maternal copy of the UBE3A gene is active but mutated. If results from a DNA methylation test are normal, your child's doctor may order a UBE3A gene sequencing test to look for maternal mutation. Treatment. There's no cure for Angelman syndrome. Research is focusing on targeting specific genes for treatment. Current treatment focuses on managing the medical and developmental issues. Depending on your child's signs and symptoms, treatment for Angelman syndrome may involve anti-seizure medication to control seizures, physical therapy to help with walking and movement problems, communication therapy, which may include sign language and picture communication, behavior therapy to help overcome hyperactivity and a short attention span, and to aid in development. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel. Updated on our latest videos.
Alright, that was an overview of what Angelman syndrome is, so I'm going to dig a little deeper in. Like in the video said, it's caused by an error in the 15th chromosome. The gene that is affected is the UBE3A. There are 4 ways that Angelman syndrome can occur. One of them is deletion positive, and this is where the mother's copy of the gene has been deleted. There's mutation, and it's basically an alteration in the 15th chromosome that is inherited by the mother. And there's the imprinting center defecate and abnormality that can be present in the center, and it's basically the gene is unavailable. And then lastly, the paternal uniparental disomy, and this is where 2 15 chromosomes from the father but none from the mother. So the inheritance, this gene is rarely inherited. The cases that have been presented have been showed that there's no reoccurrence of inheritance in them. If the origin of the disease was caused by a deletion in the chromosome or the uniparental disomy, then there's a 99% chance that it was not inherited. Although it is possible for a variant in this gene or in the nearby region of the DNA that controls gene activation to be passed from one generation to the next. So the effect on the protein, the gene that is affected again is that that one, and it encodes the E6 associated protein ligase. Basically, most patients with this syndrome receive a loss of the protein, and basically the majority of the mutations, they result in like a frame shift, missense, short in-frame deletions, or premature deletions. But this still allows for the translation of almost a full length of protein. This protein is necessary for the function of the UB pathway, which regulates the function of nephrons and the synaptic plasticity. So if there is a decrease in the function of a pathway, then basically the regulation of cell survival dies in the nervous system. So the symptoms of disease, like in the video, there's a psychomotor delay, like toe walking and jerky arm movements. There's a characteristic behavior, like happy demeanor, with inappropriate and excessive laughter, and they're often showing tremulous movements of the limbs with hand flapping. There's also seizures, sleep problems, drooling, hypopigmentation, scoliosis, and so on. So the treatment options, again, there's no cure for Angelman syndrome, but the treatment that is being offered right now is used to treat the symptoms / manage them. It as well just addresses those developmental delays. This treatment includes anti-seizure meds, physical or occupational therapy, speech therapy, sleep training, just to manage the sleep issues that they're having, and then just diet changes. So financial information. Currently, there is no breakdown of how much each treatment would be, but this disease was incurred to be the highly yearly cost of about $96,994. The resources needed, you basically need wheelchairs, and there are some special wheelchairs that can be needed. They're just observing the seizure activities, having communication aids, Just design like special forks to help them with eating, and just special toothbrushes as well, since they have whitened teeth. Once you go on that Angelman website foundation, there's a place called like the special needs, and it just gives more information of what you need and what you don't need. So changes in homes are going to be many changes. Just having accessible ramps like for the wheelchairs, so they don't have to go through the stairs. Having secure beds if they have reoccurring seizures. And they also have sleep issues, and just having a downstairs bedroom will be more convenient than having it upstairs. And here's another short video just going to explain a family experience that for the child that has Angelman syndrome.
Minnesota is shining blue tonight for Angelman Syndrome Day. 160 of our neighbors live with the rare neurogenetic disorder, including a little girl named Rose. Our Scullen introduces us to her and her family.
On my throat, right? Always smiling, always giggling, and everything is funny. She's never angry, and there are no real tantrums. Little 5-year-old Rose is almost always happy. It's the fun part of a child with Angelman syndrome, and there are many wonderfully loving moments.
Yeah. Thank you.
Angelman syndrome affects the 15th chromosome. For Rose and others, it means she doesn't talk. There are balance issues. Fine motor skills can be a problem. She has seizures, hyperactivity, and the big one, no real safety awareness, which means for the rest of her life, she will have to have 24-hour care. There have already been a couple of scares.
And she's very curious. So I mean, once we figure out how to keep knives away from her, she finds a way to get to the knives, you know.
And you can imagine just how frightening it is to have a missing kid. You have no idea where they are. But also, there's that moment of, I don't even know, how long it's been since I last knew that she was here.
Now for runaway Rose, they found a solution.
We call it red alert to know that there's a door open.
Has it worked?
Oh, definitely.
In infancy, there were signs. Suck, swallow, breathe was a problem, and her eyes were wandering very early on. Around 1, the Smiths got the diagnosis. Like most of us, they had never heard of Angelman syndrome. It was, and still is, difficult at times to accept.
Immediate grief, as any parent might, starting to think that your hopes and expectations for your kid are not at all what they expected. And it was like any parent, you can just imagine how a parent might feel.
And I would say acceptance is like lifelong, right? So I feel like at each milestone we experience a little bit of grief, right? So sending her off to kindergarten and not hearing about that first day of school, So there are we still have grief throughout at the different milestones.
Rose gets a lot of therapy and has a PC that is a tremendous help. And while she can't speak words, she can communicate in her own wonderful way. There is no real how-to book, but the family is growing right along with Rose, learning how to help her, while Rose teaches them what's most important.
And so reevaluating, like, what do I value? Like, I value being loved and giving love to others, right? And that is something that she does without parallel.
Now, there is no cure for Angelman syndrome, but there is a lot of research and a lot of awareness going on. Adults living with Angelmans really didn't have the advantage that they do now with early intervention, so a lot of them were institutionalized for almost their whole lives. That has all changed with therapy help out there and financial help as well. In the newsroom, Karen Scullen, Fox.
Okay, lastly, support. Again, there are many resources out there. Just when you visit that Angelman Syndrome Foundation, there are many more information on. There's much more information on there that's more helpful. But again, like just some support sources or just like stress management, because it is stressful to have like a kid with this disease. Just managing your time as well, because people, parents work. And then just behavior resources and communication resources, and there's just much more information on there that will explain more. And then that's it. My resources are on a Word document.